A lot of patients come to see us, and we tell them in advance that we need to do some injections. We need to do some nerve blocks so that I can figure out whether or not there's something that we can do to help you, and we can figure out whether or not it's worth your time to come. Now, a lot of patients have said over the years, well, doc, I already had some nerve blocks and they didn't do anything. Or I had some nerve blocks and I noticed that it helped with the pain. So why do we need to do this again? Well, I'll address each of those separately from each other. Let's talk first about the nerve blocks that you may have had where you didn't notice any difference. It's important for us to have that conversation and for you to know in advance that you might expect that. Nobody wants to be surprised. For me, generally speaking, I don't like surprises except on Christmas and my birthday, and I imagine that you as the patient feel the same way. And so my intent is to make sure that you know before you show up what you're getting yourself into, at least as far as we can do that for you. And very often what we've discovered is that when patients undergo nerve blocks with another doctor, with few exceptions, very often they'll say, well, it didn't do anything. And a lot of that is because the philosophy and the technique that other doctors use for their nerve blocks is different than the technique that I use these days. I use a larger volume of local anesthetic. In other words, I inject more medicine so that even if the nerves aren't where they're supposed to be, if they're somewhere in that neighborhood, that local anesthetic is going to be able to have some effect. The other reason is that very often, the anatomy book may say you have one nerve in that area, but what I've discovered is that a lot of patients have more than one, or the main branch may not be where the anatomy book says it is. And so if you use a really small amount of the numbing agent, then what you find, and what we have found, is that the effect isn't what we expect it to be. And so if that's what somebody else did before you came to see me, then that nerve block is effectively not very helpful. Because it doesn't tell me the information I'm looking for. The information I'm looking for is whether or not there are nerves that we can address to help you with your pain. And if you tell me, well, I had the nerve block and it didn't do anything, if I had done that nerve block, then I would tell you there's not much I can do for you because I know how it was done. But when somebody else does it, I can't be certain exactly how they did it, so I don't know how to interpret that information. The other alternative would be for me to say, well, if you didn't get any results from the nerve block, then there's not much else I can do to help you. Because that's what the nerve block tells me when I do it. If we get results from the nerve block, then there's a chance we can help. And if we don't get results from the nerve block, then the likelihood is surgery, in my hands anyway, is probably not going to be helpful for you. That's the main reason that I like to do the nerve blocks myself, because the way I do it is different than the way that a lot of other doctors do it. Now, a lot of times patients will say, doc, I had a nerve block and my pain went away. Okay, great, that's awesome. Tell me about your numbness. Where were you numb and how bothersome was that? And almost every single time the patient says, what numbness? I didn't notice any numbness. Well, one of the ideas behind the nerve block is that it makes the nerve numb. It numbs up that whole area that the nerve is responsible for. Now, what ends up happening most of the time is that patients often don't notice the numbness, or they don't pay attention to the numbness because nobody asked them to pay attention to it. They're just so glad that the pain is gone, but they don't notice that they had numbness, whether it was on the back of their head or on their chest or their belly or arm or wherever it might be. They didn't pay attention to that. And that's due to a number of different factors. Not the least of which is the fact that most other doctors, when they do their nerve blocks, they have the patient come in, they do the injection, and then the patient goes out the door and then comes back to see the doctor 2 or 3 weeks later, by which time the patient has forgotten all those little details. And if the doctor asks about numbness, the patient says, well, I didn't really notice any. Was I supposed to look for that? And that's a function of the way a lot of doctors' practices are set up. That's the reason in our practice I like to do the injections myself and have the conversation with the patient while the patient is numb, so we can go over what that means. Now, some of you may be thinking, I don't care about numbness, I just want to be rid of the pain. Well, just about every single patient tells me that when we do the injection, before we do the injection. But there have been a small number of patients who have told me once they're numb, oh wow, doc, I really don't like this numbness. I think this numbness might just bother me more than the pain. Well, that's really important information for me as a surgeon, because I don't want to make you numb and have that bother you more than the problem you came in with originally. That's not a good trade-off. And so in fairness to you as the patient, I want to make sure that we have a thorough conversation and that we have the conversation about factors that I think are important for you to pay attention to, which you may not have known to pay attention to when you had that injection previously.